Vietnamese Thi Ngoc Lan Pha is an intensive care nurse. The job's demanding, yet she faces the additional challenge of working in German, a language she first had to learn.
Every day after work, I'm completely exhausted after all the jobs and heavy work here. But later on, when I think about it, I'm always very proud of myself because I've almost always handled these tough jobs relatively well. Especially as here in Germany, nobody wants to do this job. And I do it well.
Thi Ngoc Lan has been working at the University Medical Center in Rostock for nearly 5 years. She completed her nurse's training here and now also acts as intercultural coach for newcomers.
I think it's also a difficult job. That's why there are so few, and let's be honest, nobody here in Germany wants to do it, so why shouldn't they train people from abroad?
Thi Ngoc Lan has gone a long way in her pursuit of a better future. Germany didn't recognize her Vietnamese nursing degree, so she had to train again here. And she had to adjust the care she provides, too.
I was quite shocked that I had to provide personal hygiene, as in washing patients. Back home, we nurses don't do that. Relatives do this for patients on non-critical wards. It was embarrassing for me to, for example, have to wash men's privates. But now I don't feel that way anymore, because I've been doing it for years.
Germany faces a shortage of around 25,000 healthcare professionals. As a result, some beds at Rostock's University Medical Center remain empty, although the hospital is relatively well-staffed. One reason is that they began looking to Vietnam for workers in 2018, and the medical center's approach also emphasizes helping new staff members integrate smoothly.
We've also got to make sure that we don't overload our current staff with too many different nationalities. In the end, we want to make sustainable gains in healthcare staff while not losing the acceptance of the workforce. That's a challenge for everyone involved.
Each year, up to 25 young people from Asia, mostly women, receive training here. What's unique is that most stay on at the University Medical Center, largely due to the clinic's retraining program, which includes arranging housing, assisting with paperwork, and offering German courses that cover typical nursing scenarios.
I find people from here speak really fast. I always have to concentrate when I'm communicating with Germans. If I get just a little bit distracted, I can't understand anymore. Older patients are often difficult to understand, or speaking to someone on the phone, because you can't see who you're talking with, so you can't use facial expressions or gestures to help you guess what's being said. That's why we always work hard to practice that.
Rostock's recruitment focus on Vietnam is no coincidence. When the city still belonged to East Germany, up to 1,500 Vietnamese people lived here and were called Vertragsarbeiter. Their community's presence is visible. Last year, this Buddhist pagoda opened its doors, just a few hundred meters from the Sunflower Building. Its sunflower mural serves as a reminder of one of Rostock's darkest chapters. In 1992, a mob attacked the residence for immigrant workers. The race riots are considered the worst in post-war German history. Vinh Van Lam has been in Rostock since 1989. Back then, he lived just a few kilometers from the scene.
We were afraid at the beginning. Now the second generation, or even the third generation, is already in Germany. So yes, we feel at home again, in Germany or Rostock.
But in municipal elections, the far-right AfD emerged as the strongest party.
Politics really don't interest me at all. I feel good here. But if the situation keeps getting more serious or stressful, then I will have to think about it. Maybe I'll have to move to where people are more open to us.
Tinoch Lanfa says she rarely gets homesick. She has made German friends through her work.
When you live abroad, the first thing you need to do is learn the language. I know a few people who've been living here for 20 years and don't know a single word of German. I think that's a real shame.
In September, Tinoch Lanfa will have been in Germany for 5 years, when she can apply for German citizenship. Her plan is to stay here and bring her boyfriend from Vietnam.